I'm going to give a quick overview of Ivizia brand eye drops. I'm going to dub these the No Snark eye drops, and I'll explain that later. The Ivizia brand is new-ish. It's been on the U.S. market about 5 years, and it's from a family-owned French pharmaceutical company called Théa, spelled T-H-E-A. And there's two products, as I showed. There is a drop in a multi-dose preservative-free bottle and a gel in single-dose vials. They are both exceptional, and I often recommend them. Let's start with the drop. Ivizia eye drops look like this. And this product is notable for two things. First, the ingredients, and second, the bottle. Now let's talk about the ingredients. Ivizia has a predecessor product. It's called Théa Duo, which has long been touted as the most popular dry eye drop in Europe. Théa Duo has two key ingredients, the most modern and, as far as I can judge, the best ingredients available for lubricant eye drops. 1, sodium hyaluronate, and 2, trehalose. It would have been really great if the company, Théa, could have just taken that product and transplanted it to the U.S., changed the package and label and language and nothing else. But no, because the FDA, in their infinite 38-year-old antiquated wisdom, still does not allow either sodium hyaluronate or trehalose to be listed as active ingredients in over-the-counter eye drops. So instead, Théa had to reformulate this eye drop. To make it superficially comply with the FDA, they added a polymer ingredient, povidone, in 0.5%. That's povidone as in short for polyvinyl pyrrolidone. Don't let anybody fool you into thinking that this is povidone iodine. And then they had to pretend that the important stuff, the hyaluronate and the trehalose, are inactive ingredients for label purposes. But then they turned around and advertised the inactives. So they got into trouble with the FDA anyway for their marketing. But that's a different story for a different day. In any case, this is a good quality but thin drop. And this is a drop for someone who wants a thin but good quality and somewhat longer lasting drop. This is not the drop for someone who needs to slather on the thick stuff all the time. The second notable thing about Ivizia's drop is the bottle. This is a terrific bottle, and it's a very arthritis-friendly bottle compared to the others on the market. You can squeeze it definitely more easily than these kind of bottles, the flat top ones. So this is also a Théa-specific bottle. It's their proprietary technology. Nobody else gets to use it, which is kind of a bummer because it's a good bottle. Now let's talk about the gel in the individual vials. These guys. Ingredients first. The ostensible active ingredient is the same as in the thinner drop. It's 0.5% povidone. But in the inactives, there's some carbamate, which presumably thickens it up, and there's also, of course, hyaluronate and trehalose in unspecified quantities. So at the end of the day, we really don't know exactly what makes it thick. It is a teeny bit thicker than Refresh Celluvisc. Personally, I like it better than Celluvisc. Doesn't mean you will. We're all different, but this is a well-liked product. If you've got severe symptoms and you want the thickest drop that you can get out of an individual vial, I highly recommend Ivizia Severe. For most people, Ivizia Severe is best used at night. And honestly, if it was possible to put this drop into a bottle, it would be on my nightstand. I should note also, I know plenty of people with severe ocular surface diseases who use Ivizia Severe during the day. That's about all I have to say about Ivizia. The weird thing is, I didn't have anything particularly snarky to say about it, just a little about the FDA. So I'm actually feeling a little bit cheated here. If you're an Ivizia fan, please post in the comments.